So this should be, if it works the way I intend it, one of the more interactive and engaging panels that we have. And I think that, we talked on the phone about how the three of you are already working together in some interesting ways, but maybe we just start, if we help the audience understand sort of each of your unique perspectives and what you're bringing to the table, and then we'll talk about a little bit of how you work together. Maybe we'll start with you, Casey.
So I'm Casey Granick. I oversee the innovations department at WakeMed Health and Hospitals. So WakeMed Health and Hospitals is a $1 billion medical center in Wake County, North Carolina. We serve 70 to 80% of the Medicare Medicaid population in our county, the 10th busiest ED in the United States, et cetera, et cetera. But we're very unique in that we're a non-academic medical center located in one area, North Carolina. That gives us an interesting perspective with innovation and with scaling innovation is because we have our unique population to focus on. We can break down our county by zip code and figure out how to target populations that way. So my job is, as overseeing innovations at WakeMed it's really threefold. We really want to invest in our internal innovators. So anybody who works at WakeMed that has an idea that they want to see, come to life to help our patients, families, et cetera, we really work to, bring that startup industry or industry support to them. Secondly, we really work to partner with external areas that help us meet our strategic needs. And then thirdly, we have a small venture fund, around $20 million that we write smaller strategic checks to really put our money where our mouth is and try to drive that innovation to really impact our patients and our families.
That's great. Kate, you want to talk about SAS?
Yeah, absolutely. So Kate Leonard, I lead our global marketing and strategy for our healthcare and life sciences customers at SAS. So SAS is about 48 years old. We're the largest privately held analytics company in the world. Global reach, massive organization, tons of customers in the healthcare and life sciences space specifically, customers all around the world in all types of verticals, but within the healthcare and life sciences space, we work with almost every single pharma organization, biotechs, all the way down to hospitals and health systems, academic medical centers, and any type of organization that hits healthcare and life sciences. And we kind of come alongside them to understand what are they currently using within their data access, how are they using that data to then drive better analytics, and then how are they using those analytics to drive better insights across their organization and then in turn impacting the healthcare and life sciences ecosystems for patients.
Cheryl.
Good afternoon. My name is Cheryl Zarosny. I'm with Optum, as was mentioned earlier. I came to Optum through a recent acquisition by United Health Group. So I'll just quick story about United Health Group. So that's the parent company, and there's two main organizations under United Health Group. The first one's United Healthcare, which most people know as the health insurance company. And the second organization is Optum. And Optum itself has three components. There's Optum Rx, PBM, Optum Health, where they own medical practices and physicians across the country. And then the third one is Optum Insight, and that's the group that my division falls under. And so we came through an acquisition of Change Healthcare over into Optum Insight about a year ago. I transitioned over through the consulting firm, and that's the group that I'm with today. Change Healthcare was, a $3 billion company, 15,000 employees, doing a lot of analytics, a lot of technology and services. And we moved into Optum Insight under United Health Group, and now we're in the 5th largest company in the world, which is still a little bit to get used to. There's a lot going on there and a lot of innovation, a lot of really focus on healthcare and how we can make healthcare better for everyone through all of our different companies and business units within the organization. So,
very cool. So Casey, maybe we start with some of the challenges that you face in terms of operating a healthcare, being a provider and operating a healthcare facility, and then we can get into how we can then bring analytics to help solve some of those problems.
Yeah, so with WakeMed being a non-academic medical center, caring for, being a safety net hospital and caring for a majority Medicare, Medicaid population, and by the way, North Carolina just now expanded Medicaid in our state, so, over 10 years later, hopefully getting some more reimbursement in place. But the biggest challenge is really trying to figure out how to meet the needs of our patients where they are. When you look at Wake County as a whole, you see that has a great life expectancy. It's really wealthy. Tons of tech and pharma and companies are moving into the area. But when you break it down by zip code, the challenges that we face is why is 27610 versus 27540? There's a 10-year difference in lifespan or life expectancy. It's huge, and those are things that that we're trying to tackle with innovations. Is what does that even mean? Why does that even occur? And asking those really tough questions. So that's what we're trying to solve innovatively, and in data analytics has become the common buzzwords within healthcare. And so it's really trying to understand how do you define those and how do you actually implement those. And the biggest issue with defining and implementing that we run into is technology hasn't really been the problem, it's been the implementation piece. So, as with COVID, or just coming out of COVID, and a lot of healthcare systems face this, we're all in the red. We're not doing so hot financially. And so there's not a lot of resources to try to put into building your data analytics and your innovations out. It's really just trying to figure out how to utilize what you have and to go off of that. And so that's a little snippet of some of the challenges that we're facing. But again, with us being a community healthcare center, ours is really just focused on understanding our patients better and deeper.
So with that challenge, do you then have to bring somebody in to help you with the analytics and the analysis and those things? Somebody like SAS?
So we actually utilize SAS, but we also use a lot of other technologies as well. Our biggest one being our electronic medical record. How many of you guys are familiar with Epic? Have a MyChart. Like everybody, it's I think someone at lunch called it the 800-pound gorilla. Yeah. So that's we utilize Epic quite a bit. It's very cumbersome, very expensive, interesting. And then we've also started to utilize external apps as well, such as SAS, Advisory Board, and a few others to help us really understand what that data looks like. But we cannot do it on our own. We're also working with our local county government to help us do community assessments and to figure out the data there. But a new way of looking at getting data is, what if we were to do something like genetic screenings for all of our patient population free of charge? So it's those types of things that we're looking at from a data perspective that we cannot do. We will absolutely have to bring external partners into the fold.
So Kate, when you hear I'm sure you've heard this story many times before, lots of hospitals across the country. What can SAS bring to the table to sort of help untie these knots?
Yeah, so being the analytics platform under all that data, we kind of sit in a different position. So when we think about Epic or Cerner or any other medical records, set of data, EHR, whatever it might be, the challenge that we're seeing from the analytics side is not so much lack of data, it's more interoperability of that data. How do we get the information that we have from a census or a geocachment analysis or Medicaid or Medicaid? How do we get the data and then be able to harmonize that data across different platforms? So it's not a situation of competing with Epic or Cerner or anything like that. It's more of how do we integrate with those tools and then allow a dashboard to be built and kind of build out that platform, build out that dashboard access to where someone like Casey or a provider or even a nurse coordinator or a site coordinator can log into that dashboard and understand all that they need to know with all of the points of data that are available to make better decisions and have better insights for whatever program they're building out. So an example of that, right? If we can do a geocachment analysis, if we can look at county by county data, state by state data, whatever area of population you want to drill into, and then we can overlay that data with race and ethnicity data, and we can overlay that with additional socioeconomic factors, and then we can overlay that with food insecurity and food desert data that we have that's publicly available, and then we can overlay that with some of the chronic illnesses that are most prevalent in a region. We can see all of that information and then decide what intervention we need to build or what intervention an innovations team would want to actually dive into and invest in. It allows more credibility for that investment to happen. It allows better programming for those physicians, those teams, those program leads to actually make a difference in their community because now they have access to all of that data. The cool thing on top of that is you don't need that dashboard to be able to view it once. You need to be able to understand how that's making changes in real time. So being able to have access to a platform that you're tracking that information, you're then building your programs, but then you're understanding am I making a difference? Is the needle actually moving based off what we're doing? If yes, let's keep doing it. If not, how do we use that insight to pivot, change that strategy, and drive better outcomes? So it's really, creating that platform where all of the data can come in, and then all of the key players can make the best decisions possible to drive the right outcomes as fast as possible.
If you need a pilot site for that, right here.
Fair.
See, more deals getting done and accelerate. So I want to say, I think you called Epic the 800-pound gorilla. Isn't that a good thing? Like, as I was starting to cover EMRs, I was like, oh, there's just too many standards, and there's interoperability is already admitted to be a problem. Like, isn't it a good thing that we were sort of standardizing around one gorilla?
Well, I guess from that perspective, it definitely makes interoperability probably easier, but there's obviously other players in the market. Within Optum Advisory, the group that I'm part of, and by the way, the advisory board are my colleagues. They're part of the same group that I'm in, and they do some great research. We have probably over 600 Epic certified people on staff in Optum Advisory, and that's only second to Epic themselves, right? But we also do Cerner, we do Meditech. So I think all of them have to come to the same standpoint around interoperability and some of the things that are out there now with regards to sort of the rules under TEFCA, and really being able to put these pieces together in a way that allows everyone to do what they do for the patients and for the members. Keep the focus where it should be. We look at it through a lot of health systems. We look at it through payers. We have like the largest industry healthcare data set, right? And so that allows us to really evaluate what's going on in the market and how best to help through the process. Total cost of care, making sure that there are no care gaps. If you're talking about government programs, making sure that the clients have good STARS rating, that their HEDIS measures are lined up, et cetera. I feel like I'm back to the room over here. So there's a lot of pieces that need to come together in order to have all this work right. And I've been doing this a fair number of years, and it's because we really truly believe, in making healthcare better, and that's always been my personal piece in terms of why I do what I do. But I think that the more data you have is a blessing and a curse at times as well, which I think we'll probably talk about in a couple of minutes.
Yeah, maybe we talk about it now, because I think as on our pre-call we were talking about all these different streams. We mentioned that having the right dashboards and making it visible, it's not just about collecting it, it's about synthesizing it and then learning from it. What are some of those challenges, and how do we go about solving them? Maybe Kate, you want to kick it off?
I'll jump in on that. One of the biggest challenges with too much data and not knowing how to code that data, not knowing how to understand, untangle, de-web that data. Data scientists right now, I think that there was an article in Insider, I think another one in Forbes maybe a week ago or so, that said that the data scientist is now the sexiest job in America, right? Folks aren't going to university or going to get a master's in data science or a PhD in data science to then go work at a hospital. They're going so they can work at Google or Amazon or Apple or these massive tech companies.
Or Optum Advisory.
Sure. So the challenge is data science is a huge field, but we're not getting the talent in the spaces that we need at most, such as healthcare and such as life sciences. So when we don't have the talent in play and we have a ton of data that has to be sifted through, we have so many streams of data, organizations just don't know what they need to do with it. They don't know how to untangle it. They don't know how to analyze it. They don't know how to drive the right insights. So the platform that you're using becomes even more important. Are you using a platform that can be democratized? Are you using a platform that is incredibly visual? Are you using a platform that you can upskill and scale your talent needs without having to go hire the $200,000, $300,000 salary data scientist that was only going to work 40 hours a week, only on certain projects, right? So the more data you have, the more resourcing that you're going to need in order to analyze and understand that data, unless you have the right platform to kind of help you do that. The challenge then on the healthcare system side is those platforms are expensive. When we're talking about community hospitals, budgets are not going to be the same as these academic medical centers or these leading research hospitals. A Duke or a Stanford is going to have $4 million they can put into infrastructure. A community hospital is going to be looking for an in-kind gift or a pilot program or something, at a discount. So we have to be able to figure out how do we, empower and enable all these types of organizations, all these types of customers to understand and untangle that data, because we're only going to get more of it. There's only going to be more streams of data. We just heard from MyFitnessPal and how much data they have. Providers are going to be looking into that data more and wanting that pulled into a MyChart, wanting it pulled into Epic or Cerner. We're going to need the change management, the process management, like the folks at Optum can provide to understand how do we navigate that. And then we're going to need the platform and the tools so that organizations such as WakeMed, watch your heads, keep moving on that one, so that organizations such as WakeMed can actually use the information they need.
So I think what I would add to that, and that's why I said a blessing and a curse, there's a lot out there. It's coming at us all the time. And that's both a great opportunity, but it's also a large challenge, right? We've all seen the newspapers. We know about security and all the issues and different things that have come down the road with that. I don't know if anybody else in here has had this happen, but I've had my information taken through a healthcare organization many years ago and had to go to the IRS and prove who I was and handle all of that, which was not a fun experience. But unfortunately, that is something that we always have to keep front of mind. And then in terms of the data that Kate's talking about, that's all data we have today. There's a lot of data that's not been put into these, I'll call them data warehouses or data systems that you can use a tool. Things like you go and get an over-the-counter kit to test yourself for something. I spend a fair amount of time talking with some startups around how they're thinking they want to come into the market and what does that go-to-market look like and how do they navigate the healthcare system and all those sorts of questions that they have. And one of the first things I ask them is, where's the feedback loop to the PCP? How does the PCP know that this person had this test and what the result was? They weren't required to put in their PCP. So you have all this over-the-counter information that is important for healthcare and for the patient and the member. And then you have things like GoodRx. You go to the pharmacy. I've done this. I was in between jobs and taking care of my daughter when she was going through an illness, and I showed up and they wanted $135 for my medicine. Most people know, as a mother, you tend to say, well, all right, I'm going to figure something else out, right? My daughter's sick. I have other things. I pulled out my GoodRx card. I got it for $9 and walked out the door. And they said, it won't go towards your deductible and all these other things. I said, you know what? I don't care. I got the medicine. It doesn't matter to me. That's also not really shared anywhere, right? So you've got that sort of information. My husband, has a blood pressure cuff at home, and he takes his blood pressure and has to, keep track of those things. That doesn't go anywhere unless you then bring it to your physician. So we are still missing a lot of data points as well that could be helpful. And I think as things evolve and we have more innovators, most of which we've seen today, I do think we have to look long-term about how we can connect that information so that it can be useful in terms of diagnostics and also prevention, really. It should be, not a sick healthcare system, but how do we help with prevention and wellness and all those sorts of things.
That's a great point. We didn't talk about it when we talked about home diagnostics, but closing that loop with the PCP is like, many consumers may do it, but if it's not automatic and there's no infrastructure to ingest it, then all that data is lost.
Right, and that particular vendor at that time, that wasn't their focus.
Yeah.
And we pointed it out in terms of a care management protocol. And what if they find out something that they desperately need medicine for, and the patient doesn't go? That PCP would never know unless something happened.
Yeah, that's a really great point. Just even speaking, so I have the opportunity to meet with hundreds of startups every single year just to learn more about what they're doing and potential investment opportunities. But one thing that's been really interesting is, I did say Epic was an 800-pound gorilla, but it is by far an incredible tool that has absolutely changed the landscape of healthcare. What's really interesting, though, is I have a son who's 3.5 years old. He's special needs, and we live in Raleigh. Kate and I live in Raleigh, North Carolina. And so we have access to Duke, UNC, WakeMed, incredible healthcare organizations. Epic is great, been able to go and make all of his appointments, see all of his providers. But one thing that's really interesting that with the data interoperability is that he had genetic testing at UNC. If it wasn't for the fact that I worked at a healthcare system and I knew that genetic testing was going to end up in the media tab of Epic, and that the endocrinologist or the neurologist would have to then find it in the media tab, pull it out, and then try to reread the results. I worked in healthcare, so I knew to print it out and bring it. That's one of those things where it's just like, Epic isn't even able to always talk with Epic because it's really diversified by the healthcare system and the resources that the healthcare system is able to put into the Epic tool, which is really Epic. I'm not trying to pick on Epic. It's a great tool. Don't get me wrong, but it just shows that we're working really, really hard to innovate in healthcare, and we have a really strong talent. But it's a lot of work, and it's by no fault of WakeMed, Duke, UNC, Epic, etc. It's just that the resources are really hard to come by, and some things that you would expect to be there with the data interoperability aren't there quite yet.
They definitely have a ways to go. I think the other piece too that we haven't really figured out, all the wearables. Everybody's going around with all their wearables, right? And probably a month or two ago, I woke up in the middle of the night, my husband's watch was going off. I don't know what it thought was happening to him, and I woke him up to make sure he was okay. If that had been an actual episode, it would have been good that could have somehow connected so that when he went into his PCP, that there was a way to have that information available. As it turned out, I think the watch was kind of doing its own thing, and it really wasn't a problem. But now that we have these things, it's great, but then all of a sudden it can be a false positive too. So you still need to have medical review of these things. And in terms of the interoperability, I think that Epic ended up being one of the first, what they call QHINs, for the Health Information Network. Not surprisingly, they were one of the first ones that were approved to be one of the QHINs in the U.S. And that's been a great thing to see how they've tried to bring the product forward, and hopefully that will spur others to do the same.
Let me ask a forward-looking question about. So, I think we've identified where we are, some of the challenges, some of the solutions, but how quickly are things getting better? Are they getting worse? Make some predictions for the future of healthcare and analytics and resolving some of this tension.
So I would have to say it's absolutely getting better. More people are becoming aligned with the benefit of utilizing all of the data that we have and being able to make really being able to dig down into your zip code and figuring out why that specific neighborhood has one disease or etc. Once you see the impact that data can make, and once you see the impact that the innovation around that can really have on your community and hopefully globally, people are able to rally around it. And so I think in the future it's going to still be a long, hard road because it does take a lot of resources, a lot of time, and a lot of money. And fortunately and unfortunately, there's a lot of regulation that comes with healthcare. So I'm sure, with the FDA is now starting to get more involved with clinical decision support, as they should. It extends that timeline a little bit, and it causes more checks to be written, etc. But I think we're looking up and going forward regardless.
I'm super excited about the future of healthcare and analytics in particular. I think that we're kind of at an inflection point right now that we know that things haven't been working the way that they've been, operating. At SAS, we just launched a product called SAS Health that addresses and kind of works to address all these interoperability challenges. At the same time, we are dabbling right now into some Gen AI tools, some large language models. How do we use better predictive analytics, generative AI, and then also standard or traditional AI to help drive these insights in a better way? And then we're also working with, some of the leading hospital and health systems around the world, Erasmus Medical Center, Amsterdam United Medical Center, and several others to figure out how do we actually drive outcomes in a faster manner. We're not just talking about it, we're actually doing it and showing impact. So I think that right now we're at an inflection point, but in the next 3-5 years, we're really going to see strong change.
I would agree with everything said so far. And I think the key thing really is for the organizations to have that top-down support for the data, and having a data governance policy and a data governance team in place, especially as you see more and more things come out related to AI and natural language processing and all of those great tools that we can leverage. That's super important. And it is a true fact that the organizations can't have the data scientists and all these folks on staff, and that's where organizations outside can help you and help them leapfrog to where they need to be, where you don't have to have those people on staff, but you can benefit from having the tools available and created for you. And I think the last thing I would leave you with is I was reading a study recently, and greater than 90% of healthcare executives agree that access to data is critical. Greater than 90%. Only about half of them are using data to make impactful business decisions. And that's whether it's operational, clinical, executive decision making, and having dashboards like what can be produced in SAS and others will help organizations like WakeMed and others in the healthcare ecosystem.